Hi Lisa, welcome to Scott and White Health Plan headquarters.
Hi Dr. Preston, thank you for agreeing to hear my case.
Tell me what brings you here today?
I was recently diagnosed by an oncologist in your clinic in College Station with sarcoma cancer.
How would you like for me to help?
I am a wife and mother of 4 young children between 4 and 10. I need the best medical treatment available.
You are in the right spot then.
I am not sure you are following me. Sarcoma cancer is one of the rarest types of cancer. On top of that, my tumor is located in the breast, an extremely rare place for this type of cancer. In fact, less than 5% of the people that even have sarcoma cancer have it in the breast.
We are familiar with your diagnosis, and I'm confident in our staff and their ability to help you.
That is good to know. I was getting a little concerned after I had to go through so much red tape with your organization just to get a second opinion at MD Anderson.
Well, Lisa, you must realize those appointments cost money, but we did approve them, didn't we?
Yes, you did, and I'm grateful for that. Especially since the diagnosis and treatment that Dr. Hunt and her staff at MD Anderson made was drastically different from the one provided by your staff at Scott and White.
Although the diagnosis and treatments might have varied slightly, I'm still confident in our doctor's opinion.
I still don't think you are following me. The treatments didn't differ slightly as you suggest. Rather, they are radically different. The treatment recommended by Scott and White was an immediate mastectomy with no proposed follow-up treatment. No radiation, no chemotherapy. The treatment Dr. Hunt and her staff at MD Anderson, the #1 cancer center in the nation for out of 5 years, recommended a lumpectomy and possibly radiation and chemotherapy.
I see, but doctors have differing opinions all the time.
No disrespect, Dr. Preston, but I really don't think that you do see. In fact, Dr. Hunt and her staff at MD Anderson believes that your oncologist may have misdiagnosed the type of cancer altogether.
Well, I wasn't aware of that.
Well, actually you were. Not only did Dr. Hunt call your office directly and explain the situation in depth, but she also sent you a letter which I happen to have a copy of right here. Would you like me to read it?
No, that is all right. I vaguely remember something about it now.
I'm sure you do. In addition to the potential misdiagnosis and treatment, you stonewalled me using tactics designed to get me to have the surgery completed in College Station.
What do you mean?
Dr. Preston, the cat is out of the bag. Rather than agreeing to cover the treatment in-network, as recommended by MD Anderson, you agreed to out-of-network coverage, knowing full well that the terms you offered are not acceptable to MD Anderson.
Oh.
In fact, many different MD Anderson representatives told us that Scott and White knows that the terms they offered are not acceptable to MD Anderson in advance, and that Scott and White uses this as a common tactic to appear as though they are cooperating, but knowing that they are actually preventing their policyholders from getting the treatment. Several representatives said it would have been better for me had Scott and White to actually decline the referral, because that opens it up to a complaint at the Texas Department of Insurance to have a speedy appeal in 24 hours.
That is pure speculation on their part.
Then would you explain to me why your appeals process takes 30 days?
That is our standard procedure.
Even in rare and unusual circumstances such as these?
I'm afraid so.
So, what are my options?
You can pay 50% of the total cost of the surgery to have it completed at MD Anderson to try and save your breast, or you can have a complete mastectomy fully covered here at Scott and White.
Why was I not given the option of a lumpectomy at Scott and White?
Good question. Either our oncologist didn't believe it was a good solution, or our surgeon is not qualified to perform that type of operation.
Exactly. I think you are starting to see why we are requesting treatment at MD Anderson, the best cancer center in the nation. They are able and willing to perform that type of treatment.
Lisa, we offer the same standard of care as MD Anderson.
Are you kidding? You are telling me that you offer the same standard of care at the top cancer center in the nation?
Yes, I believe you will be in great hands with our oncology department.
You do mean your sarcoma department, right?
I don't know quite how to explain this, but we don't exactly have a sarcoma department.
You don't?
No, we don't. You see, sarcoma cancer is very rare type of cancer. In fact, our oncologist in College Station has only seen several cases of it in his entire career. Therefore, we don't technically have an active sarcoma department.
That is exactly why I need to be seen by Dr. Hunt and her team at MD Anderson. Other doctors that specialize in sarcoma send their clients to her when it is located in the breast. And you are telling me that Scott and White is offering me the same standard of care that I would receive at MD Anderson.
Although I sympathize with your case, Lisa, we still are not able to cover the treatment in network.